It's funny how we started out with all men and now we've got all women. We're totally segregated. All right, let's see what our ladies have to say. So today, this afternoon, our panel will cover how to take care of your whole self, topics around pain management, mind, body, and health, and more. So please welcome our panelists. We have Dr. Jamie Fertal from St. Joseph's Health. We have Amanda Trimmell from Memorial Care. Uh-oh, Anusha, I'm going to destroy your name. We have Anusha.
Wijeyakumar.
Ah, perfect. Health and wellness coach from Hoag. And we have Jean Dean, sorry, from St. Jude, I'm fired, Centers for Rehabilitation and Wellness. All right. So let's have Dr. Fertal up first.
Testing. Everybody hear me okay? Good afternoon, everybody. I'm Jamie Fertal, and I do palliative care. I'm also an internist and a geriatrician, and I was asked to come talk about my favorite thing in the world and how it pertains to MVC. So I figured I would give you a little bit of an overview on palliative care because it's still a little bit of a mystery for the vast majority of the folks that I meet. So stop me at any time or if you have questions, but sure, is this better? Okay. Okay, so palliative care is, as I said, my very favorite thing in the whole world. It is the medical subspecialty of pain and symptom management for people with complex disease. If you ask several palliative care clinicians the definition, you're going to get several different definitions, but complex disease has always seemed to me to be the very best title because it doesn't have to be a category. Certainly here we're talking about it in the context of breast cancer. What we try to do in palliative care is really not necessarily fix things. We aim to address the symptoms and the difficulties that individuals encounter when they're dealing with a complicated medical issue and the treatments for the complicated medical issue. So, for example, pain management is, for some patients, a major part of what I do for them. For other patients, I don't even delve into it because for whatever reason, that patient is physically comfortable. So, the major categories that any palliative care clinician is going to try and cover includes physical wellness, physical comfort, and that, of course, entails getting a really, really great idea of what types or if your patient is feeling pain, physical pain. Then there is the GI tract, which plays a huge role in keeping you fed and keeping you hydrated. And if that's not working in good working order, then it can derail everything else. So things like thinking about food, preparing food, eating food. And then, of course, there is the other end, which, again, if that is not working correctly, can derail everything. Then there is the family dynamic as related to food. For example, why aren't you eating food? I've made this special dish for you. And then the person feels badly that they cannot eat it, and then there's bad feelings. So there is a trick to sort of trying to be very, very easygoing with regard to eating and not eating. Then there is mood, emotional well-being. So things like as easy as depression, which is not easy at all, and things that are a little bit more complex, such as anxiety, anticipatory anxiety with relation to treatment or not, or anticipatory anxiety related to seeing your doctor and you're not sure what they're going to say. Those mental health components are so very, very important that, as I said, everything else can be going quite smoothly. And if your mental health isn't well supported, well inquired into, everything will be derailed. A close cousin of your emotional well-being or involved in your emotional well-being is sleep. Your ability to sleep restfully, your ability to maintain a circadian rhythm that is to your liking. For example, some people, for whatever reason, are night owls and really prefer to do their napping during the day. Again, we would strive to try and help you get your circadian rhythm to your liking, whatever that may be. Mobility issues and your ability to continue doing activities that you like to do or need to do or want to do, like work, like caring for your loved ones, like hanging out with your kids or your grandkids, like charity work, if that's what you like to do. So again, the whole art of palliative care I couldn't be prouder of, because the whole point is to find what is important to each individual human being and help them get that aspect well controlled, well addressed. I thought perhaps I would pause just for a moment, because that was a ton of information. Does anybody have questions about palliative care or any of the subcategories that I've mentioned? Certainly, I've been around the block a little bit. I'd be happy to speak to. Oh, go ahead.
Do you have patients that come in with insomnia, and how do you treat them?
So the question was, do I have patients with insomnia? Yes, every single day. I would say I'm not sure that I've had a day in clinic that I haven't had a patient come in with problems with insomnia. Problems getting to sleep, problems staying asleep, problems getting back to sleep, problems waking from pain, problems waking from anxiety, problems waking for they have no idea why. Yes. What do I do about it? Well, that's a very big ball of wax, but the way I approach symptom management, again, this is just me, but I have a feeling I'm not alone, is I think about what the human body is meant to do. Just in the simplest terms, we are meant to be awake during the day, move around, and then go to sleep at night. So if someone is not able to go to sleep at night or stay asleep at night, I try and figure out what is abnormal that may be getting in the way. So the number one thing that I address is, are you hurting really badly when you go to bed? And so getting comfortable is not possible. Well, that's a relatively simple thing, again, as things go. Are you feeling really anxious, little worried, little scared, for whatever reason, and when you lie down, it's quiet, and it's an ideal time to perseverate over things that maybe make you feel not happy or worried or what have you. Then there are bathroom issues, etc. I think that means I don't have so much time left. Okay, is there anything else that anyone would like to ask in front of the group? Yes? Uh-huh. Personal opinion alert. Yes, I do. I believe that a balanced diet, period. What suits your own preferences. So I want all of the nutrients, all of the amino acids, in whatever way you choose to get them. Oh, I guess one more, if I'm allowed.
What is your definition, the difference between palliative and hospice?
I could talk about that for a really long while.
I know what people have different opinions of what.
Palliative care is, like I said, the medical subspecialty of treating complex pain and symptom management. The other part that's harder to describe is guiding your patient through the roller coaster of life. And so palliative care does not generally involve someone who is no longer coming to the hospital for medical problems. Hospice care is at home, meant to help you feel comfortable and not come back to the hospital. So my practice is very much involves the hospital and the clinic with relative frequency to manage symptoms, whereas hospice, not so much at all. I can talk a great deal more on that, but I think perhaps I ought to do it afterwards.
All right, great. Thank you so much. I mean, these are really important issues, and obviously sometimes it's very difficult to get this kind of information. So I suspect you'll be seeing some more questions soon. But in the meantime, we have Amanda Trimmell, right? You're going to tell us about nutrition. So we just had a question about nutrition, so we'll get a little bit more now.
Perfect, thank you. Yes, I'm a dietitian, so I will be talking about nutrition, and I will answer that question as soon as my PowerPoint comes up. But I'm a dietitian at Saddleback Hospital. I've been there for about 13 years. It's what I love. And once my PowerPoint comes up, I'll start. What? No, I don't want to sing for you. I did enough dancing, though. That was good. That helped shake out some nerves. So, okay. So what we're going to talk about today, we're going to talk about nutrition during treatment, some strategies for symptom management, and prevention of reoccurrence of cancer. So I love this quote. Let food be thy medicine and medicine be thy food. However, I would like to change it a little bit because we've heard about some really impressive medical treatments that are out there for metastatic breast cancer. And so the way I want to tweak it is let medicine be the thing that helps, or let food be the thing that helps medicine work perfectly in your body. A body that is nourished, a body that is balanced, a body that has the building blocks to grow, recover, and learn is going to allow that medicine to work optimally in your body. So shifting your thinking about nutrition from diets or fads to really how do you nourish it. Okay, during treatment, there are some different symptoms that we tend to see and that I run into all the time as a dietitian with my cancer patients. Weight fluctuations is a big one. I have patients that have a lot of uncontrolled weight loss, and I have patients that have uncontrolled weight gain. These are some different tips that you can use or strategies that you can use to combat some weight fluctuations. If you are experiencing weight loss, you probably aren't eating a lot, and you're probably not eating a lot at one time. So, and the trick isn't to sit there and force feed yourself huge, large meals. Eat more often. Even if it's a couple bites of something, just eat more often. I have a couple patients that have set a timer or have Alexa go off every couple hours, like time to eat. So that's a good strategy, is just get it in. Eat when your appetite is the greatest. Often it's in the morning after you've been sleeping. Make that your biggest meal, and then the rest of the day, you're just working on those small meals like I was talking about. Drink things that provide calories. Increase your calories and protein. Focus on fats and healthy proteins. And it is harder on your body to be malnourished than it is to eat things that people consider unhealthy. So if you are deciding between not eating or having a milkshake, have a milkshake, okay? Because it's harder to be malnourished. So that's my weight loss patients. My weight gain patients. Enjoy your food, continue to eat regularly, reduce your portion size, or my favorite one is think about things that you can eat more of. Eat more of the good stuff. Eat more fruits and vegetables. Whole foods, that's the one thing that never changes in nutrition, right? The science of nutrition is new. It's young compared to the other sciences. And there is a lot of misinformation out there. The one thing you will never hear is that fruits and vegetables are bad for you. Everybody agrees fruits and vegetables are good for you. So have more of those. Fill your plate with more of those items. Enjoy your food more. Sip, savor, smell your food rather than eating for comfort or eating for stress management. Make sure you hydrate with things that don't provide calories, like water and tea. Okay, if you are having some of those nasty GI symptoms that a lot of our patients experience, try to emphasize foods that are bland, cold or room temperature versus hot foods. Hot foods tend to have a lot more flavor or smell to them. So focus on cold or room temperature food. Lower fiber foods are easier to digest, so they move through your GI tract faster. And that's either cooked fruits and vegetables or the white grains versus whole grains. Eat smaller meals and eat more often. There's also a couple probiotics that could be helpful, Lactobacillus acidophilus and Bifidobacterium bifidus. Those two can be helpful for helping settle some of those GI symptoms. If you're noticing appetite changes, which is another really big one that I see with my patients, you have to shift your thinking about food. Food may not be as enjoyable as it once was, especially if you're battling some of those GI symptoms where you just don't feel like you want to eat, or you're nauseated when you do eat. Really think about it as medicine for your body, or the tools to help the medicine work in your body. Make meals more enjoyable or social. Eat with friends and family. Set a timer, like I had mentioned, and even a few bites can add up. So even if you keep on that frequent small meals, even a few bites of something adds up in the long run. If you're noticing taste changes, you can emphasize other flavors to kind of balance it out. If you're noticing you're tasting different things. Okay, nutrition for prevention. This is the answer to that question. Studies show us that the Mediterranean diet is the most effective for prevention of reoccurrence in cancer. The key to that, and I totally agree with our doctor over here, that it really is about balance and getting adequate nutrition. It emphasizes fruits and vegetables, that one truth of nutrition that never changes. Lean meats, healthy fats, beans, lentils, and meatless meals. And you could do those things. You could get a lot of fruits and vegetables. You can get some of these healthy fats in different dietary lifestyles, but this is the one that's been the most studied and has yielded the best results, not only for cancer, also for heart disease and diabetes. Maintaining a healthy weight, be physically active, manage your stress. Alcohol consumption should be limited, if any, less than 4 drinks a week, and that doesn't mean you have 4 drinks on one day. 1 drink a day or less, if any. Moderate caffeine and soy intake. The research that I have seen regarding these two things is you don't want to do too much of either one. So moderate caffeine intake is about 1 caffeinated beverage a day, so a cup of coffee is about 200 milligrams. And 1 to 2 whole soy foods a day can have a protective benefit against recurrence of breast cancer. Oops. And a quick word on supplements, because I get also this question a lot. The problem with supplements is that it's an industry that's not regulated, and the agencies that do the regulation, no one regulates them. So sometimes what they put on the bottle isn't necessarily what's inside, and sometimes what they say it can do, it can't do. So be cautious when taking supplements. There is no supplement that can treat, cure, or prevent cancer. It doesn't exist. But there are protective benefits in foods, specifically in fruits and vegetables. And it's when they're in that symbiotic whole food that we receive a lot of the benefit of it. You can take too many vitamins, so don't just take them just to take them. Talk to your doctor or dietitian before you start taking anything. Thank you.
Thank you so much. That was really excellent. I think the whole holistic approach is so important, and it's great to hear some more details about how we can implement this in our everyday lives. So next we have Anusha Wijeyakumar. Did I get it that time?
Wijeyakumar.
Ah, dang. And she's going to tell us a little bit about mindfulness.
Yes, thank you. I think I have a presentation as well, but in the interim, I'll begin with an introduction. Good afternoon. What a pleasure it is to be here. I had the fortune of speaking on the panel with other Hoag specialists last year, and it's wonderful to return to talk about mindfulness this year with a real focus on self-care. Now, if we're familiar in wellness, self-care and self-love are very much trending topics. And I kind of want to break that down today in terms of what that means with regards to mindfulness and meditation. So, just a quick introduction. I am Anusha Wijeyakumar. I'm the wellness consultant for Hoag Hospital. I lead on all of their meditation and mindfulness initiatives for their Women's Health Institute. I specifically work on their breast cancer survivorship programs, their pre-Viva programs, those that are at high risk of getting breast or ovarian cancer, and our maternal mental health programs. And it's something that I really enjoy, specifically working with our breast cancer patients, because being a woman, women's health is very, very important to me, and empowering women to lead their best lives is something that I have a great passion for. So hopefully I'll be able to enthuse you all enough by the end of my talk today to kind of really understand what mindfulness is and to think about how you can make it an integral part of your daily life. Because ultimately a one-size-fits-all doesn't work, right? So what I want us to all think about today is we're each different, unique, individual personalities. So I can give you research, which I could do for hours, right? Or I could tell you about the benefits, what's worked in my own life, what's worked in the lives of my patients and clients. But ultimately, you have to experience it for yourself, which we'll get an opportunity to do. And then you have to make it work for you, right? So that's kind of what I want to break down today. How can you make mindfulness a daily part of your life and integrate it into your routine? So what is mindfulness? So very simply, I mean, it's a term that we hear so often these days. It's everywhere. You go to the supermarket, there are, generic publications that are talking about meditation and mindfulness. It's on the radio, it's on television, it's everywhere. But what is it? So very simply, it's bringing your mind into the present moment, which is right now. So here's the litmus test, friends. I'm sure you're all listening. But are you also thinking, I'm tired, right? I'm hungry. What do I have to do at 5 o'clock today? What do I have to do tomorrow at 2 p.m.? What's happening on Wednesday? What's happening next Friday? And the list goes on. And if we're honest, that's most of us. We're kind of paying attention to what's happening, but then we're not. And a really good example that I like to give, especially for those of us that live in Southern California, is driving. That's why we see so many accidents, because we're practicing mindlessness on the road, right? So people always say to me, how can I practice it? When you get in your car, if you're driving, that's when you can begin to practice it. Because again, even myself included, we get from A to B, and sometimes we have no idea how we've arrived. We've gone into that autopilot mode, and we've been thinking about everything other than what we're actually doing. So mindfulness is that you're bringing your mind into the present moment, which is right now, in this very room. Right? Because ultimately, that's all that we have control over. We can't change the past, no matter how much we may want to. The past has already occurred, even what happened 5 minutes ago, and we can't predict the future. And for most of us, we tend to oscillate between those two places, right? Where we're either trying to change the past or we're worrying about the future. And the one thing mindfulness kind of trains our mind to do along with meditation is to stop worrying. I know that's really difficult. Because those of us, and I think women have more of a propensity towards this, is to worry, right? We're worrying about other people, we're worrying about ourselves, we're worrying about whatever it might be. And I think one of the most liberating things about adopting a meditation and mindfulness practice is it helps us alleviate our own suffering within. So that's really what mindfulness is. Right? It helps to liberate ourselves from our own internal habitual negative narrative. And if we're able to do that, that we've won half the battle right there, right? Because what we see, right, especially in the West now, is we tend to live in the prison of our own minds. So through these practices, think of it as a way to alleviate our own suffering and as a form and a tool of liberation. And the wonderful thing about meditation, which, by the way, I just had this conversation at my table earlier, meditation is yoga. In the West, we get very confused by this. So think about meditation as being the original yoga, which it is. In the West, we get very confused thinking yoga is asana. Asana is the physical postures. The only reason that we even do the physical is to ready and steady the mind and body to come into that place of stillness and quiet within. So the wonderful thing about meditation is until we take our last breath, there is always hope. Hope for the mind to change. Now, it's not going to change if we're meditating once a year, right? Guess what? Nothing will change. Even if you're meditating once a month, not much is going to change. Even once a week, you have to do these practices daily. And I'm the firm proponent of we all have 5 minutes. Nobody in this room can tell me that they don't have 5 minutes because we spend 5 minutes doing nonsense, right? We all do. I always say to patients and clients, there's only so many animal memes we can look at, right? As cute as the cat or the squirrel is, right? There's only so many of those we can look at. Or we're watching the YouTube video. Or think about some of the conversations that we have. Quite pointless. So think about dedicating, time. I'm not saying you have 60 minutes, but you've got 5 minutes, right? 5 minutes to dedicate to a practice that can and will change your life. So we know the impact of stress in the body. I mean, stress is pretty much now being correlated back to every disease, specifically the spread of breast cancer. Okay, we don't have time to get into the research today, but very simply, through your breath, this is proven, through your breath, when you take an inhale and you force an exhalation, you activate the parasympathetic nervous system response in the body, which is the aspect of our central nervous system that calms us. So when you take an inhale and you take an exhale, you activate that calming state of being, right? Versus living in the sympathetic nervous system response, which is that kind of fight or flight. So we'll have short time to do a little practice that I want to teach you all today, but just through your breath, you are able to alleviate those elevated levels of cortisol in your blood, which are related to, weight gain, lower life expectancy, stress, anxiety, heart disease, high cholesterol, hypertension, and the list goes on. So I'm sure we've all felt like this. Our stripes are unraveling. We don't know why. We know why. Stress. Right? Anxiety. So what is the solution? Regular physical exercise. Now that might not be conducive for a lot of you in this room, but as part of the clinic I was at just yesterday with Hoag patients that have had breast cancer and have just finished chemotherapy, I was talking to them about the power of nature, and I just want to spend a minute talking about that. The University of Exeter, where I'm not from Exeter, but I'm from London in the United Kingdom, recently came out with research that found that did anyone read that research? It's well worth looking into. What they said is that every single participant as part of that study from a wide range of socioeconomic backgrounds, ages, and physical abilities benefited from being in nature. So just sitting on a park bench. I recently worked yesterday with a young breast cancer patient that had chemotherapy and just was feeling really fatigued and isolated as well. She wasn't getting the support from her friends, which she found very disheartening. She wasn't getting support from her family because they weren't here. So she just kind of wasn't motivated to do anything. And I said to her, just drive down to the beach and sit on a park bench or get down to a park, right? And if you're able to, if you're feeling capable, walk along the beach for 5 minutes, for 10 minutes, but even just sit on a park bench. So those days when you're feeling really fatigued, even if you can't drive somewhere, maybe you just sit outside. Because the healing benefits of nature, that research is in its infancy, but it works. So I highly recommend everybody today 5 minutes of meditation or mindfulness and 5 minutes in nature a day. And for those of us that live in Southern California, there's no excuse, right? We don't have the weather as an excuse. So there really is no excuse. So now we're going to have a few minutes just to kind of break down mindfulness. So we're going to do this in our chairs. And by the way, that's exactly where you should be doing it. We also want to debunk those myths that we have to be sitting in, Padmasana, lotus pose, staring at the tip of our nose with the roof with our tongue on the roof of our mouth. It doesn't matter. None of that matters. What matters is the spine is straight. That's it. Okay? So you could even do this practice lying down. If you are lying down, just remove the pillow from underneath your head so the cervical spine is long and in line with the rest of the spine. So uncross your legs. You're sitting upright here. Palms can be facing up or down, whatever serves you best. And you have two options here. You can either close the eyes or keep them open. I highly recommend that you close your eyes. That way you're just not staring around the room and looking at what everybody else is doing. So kind of avert one of our main senses of sight here. You can either stare at a focal point on the ground or gently close your eyes. And we're going to begin with 3 deep inhales and 3 deep exhales. So exhale all of the air out of your lungs. And that's an audible exhale. That's what activates the parasympathetic nervous system response. So let's take a deep inhalation and an audible exhalation. So you're sighing the air out. 2 more times. Deep inhale, loud, audible exhale. 1 more time, your deepest inhalation yet. And now completely release, letting everything go. And just take a moment to arrive into your body, into this moment, which is all that we have. You're relaxing the shoulders down away from the ears. You're releasing the tongue from the roof of the mouth. You're releasing any tension in the neck, the jaw area. And you're just taking a moment to notice any thoughts present in the mind without attaching to those thoughts, simply noticing the physical sensations in the body. And if you're feeling any pain or tension, I want you to direct your breath towards those places. And just acknowledge what is happening in your mind, in your body. And then I want you to expand that throughout your body. So taking this awareness throughout your entire physical body in this moment. If there is any pain or tension, you're utilizing your breath to move into those places. If the mind is wandering, you're gently drawing it back to the sound of your breath in your body. As you acknowledge, you draw awareness throughout the physical body. And then you utilize your breath, which is your prana, your chi, your life force, to move any areas of tension, any pain in the body. And now you gently open your eyes. So that's a very, very simple mindfulness practice that you can utilize anywhere, in treatment, post-treatment. You're acknowledging. Very often we're not even acknowledging what is happening in our own minds, which causes stress, which causes anxiety. You're then bringing awareness to the physical body, to what's happening in your mind. And then you're utilizing your breath, right? To move any pain, to detach from negative thinking. Because ultimately, meditation is concentration. You're training the mind. And Dr. Van der Molen, I'm not sure how many of you were here last year. He's our medical oncologist at Hoag. He spoke, I think we all had, 7 minutes to speak. And in 2 minutes, he'd summarized his point. But it was a very, very salient point. What he said has stuck with me for the past year. And he said, research has proven that those that have a positive disposition towards their chemotherapy have a positive result. And those that have a more negative disposition have a negative result. And I say that to my patients and clients all the time, right? The power of the mind is unparalleled. And I'm sure each and every one of you are tapping into that power. And I urge you to continue to do that. So thank you very much. And make meditation and mindfulness a part of your daily life. You won't regret it, and get out in nature. I think there'll be time for questions afterwards.
Thank you so much. That's very inspiring. Next up, we have Jean Dean, who's going to tell us a little bit more about the importance of yoga and exercise.
Yes, I feel like I should do a caboose dance or something right now. Very mindfully do a caboose dance up here. Yes, and I also have a slide presentation. And before it goes up, I'll just, again, I'm a physical therapist. I work at St. Jude's. I work in cancer rehab. And my goal today is to let you know what it is for the benefits that exercise does for you when you do it, especially as a cancer survivor. What evidence says about exercise and movement that are specific to cancer survivors. There's couple of studies specifically about breast cancer that's metastatic, and empower you to understand exercises that you can do, okay? So, choose to move. Physical activity, as it says up there, is a planned, structured, repetitive physical activity, and it's aimed at improving or maintaining one or more components of physical fitness, as defined up there. That's anything you do for movement, okay? Current recommendations are 150 minutes a week of moderate activity or moderate intensity aerobic exercise. So you're walking. Okay, so what's in it for you, okay? Very mindful pose up there, don't you think? So it improves your quality of life as evidenced in groups. It reduces your fatigue, and this is your chemo, your radiation, your general cancer fatigue. Reduces body fat, your waist to hip ratios, your adipose tissue goes down. And so, provided that you're also eating appropriately, mindfully eating appropriately, so you have less risk of cancers. Your cardiopulmonary function improves. Those of you that have been through radiation or chemo, that can be very well compromised, and it can help to restore much of that. Reduces mortality of women. There's a study I'll talk about later. Reduces your blood sugar levels. The blood sugar actually goes straight into the muscles rather than needing to insulin dump, which can cause some irritation and potential cancer problems for you, further cancer. Increases your immune system and reduces inflammation and reduces your stress hormone, and I got a little ditty about that one. And reduces estrogen production. I think about 60 to 70% of breast cancers are ER positive, and so it can reduce that receptor feeding. Improves your cognition, your chemo brain, that fog can be lifted. Natural aging cognitive changes that happen too. If you exercise and move, the flush of blood flow to your cerebral cortex gets better, and so you think clearer. Okay, so survivorship is growing. There's a couple of unicorns in the room, I hear, so you guys all know that. Studies on metastatic cancer can be found, although they're scant. And I'm talking about particular to exercise. Most of them look at the benefits of exercise rather than, and the prevention of reduced risk of cancer. Very few focus on mortality or longevity of life, but I do have a study on that one. There is a very exciting trial that's going to be going on soon. It's called ABLE, and it's on advanced breast cancer. All stage 4s, all in various forms of treatment for their breast cancer. And they're looking specifically at bony mets of the spine and the long bones. And they're looking at what exercises is important for them to reduce risk of further injury or what could make their bones actually improve. All the studies that I saw, and I went through a lot of what's called Cochrane database reviews for exercise and yoga, none of them showed really a risk of movement as long as it was a moderate intensity, not vigorous. With that being in mind, if you do have bony mets, you do need to be aware of certain movements that are not good for you, like twisting, jumping, that kind of stuff. So, study in 2007 found 4 areas that breast cancer survivors complain of: arthritis, heart, balance, and vestibular and hearing. They all feed on themselves, and they all can make things either get worse, or you can exercise and move and make things better. When you have arthritis, you have pain, you don't want to move. When you don't move, your cardiopulmonary system falls into disarray, you become more deconditioned. When that happens, you're not moving around and balancing, and so you're more at risk of falls. With vestibular and hearing issues, which chemo can affect, you want to withdraw, so you want to disengage, and that makes it all worse. You start moving, you start engaging, you start doing things, and it can spiral it back into a positive realm. Okay, so with that bit of information, what do you do with it? Well, you look at exercise. What can you do? You have traditional, your gyms, that kind of stuff. You have your untraditional, your yoga, your Tai Chi, your Pilates. And I don't want you ladies to discount housework and gardening. Anything you love to do that's pleasure, where you exert yourself. Remember the definition of physical activity. That is work, okay? Caring for the kids is work, okay? Okay. Exercise versus yoga. Exercise, again, you know what it is. It's provided by PTs, athletic trainers, gyms, wellness groups. Okay, yoga, much the same. Both of them can be found on YouTube. Often the yoga is combined with a breathing, a stretching, a movement, a posturing, and a meditation. There's like 3 components I'll get into in a second. If you go for either one of these, look for a place or a center. I work in cancer rehab. If there's a yoga instructor that knows about cancer, that's a good one to go to too for cancer. They have a better background about what you're bringing to the table with your cancer treatments, as well as what to do with your comorbidities and how to keep you safe and healthy with your movement patterns. Okay? So, yoga. It's an old philosophy, over 4,000 years old. In North America and in Europe, we use it as a physical and mental health well-being. It's not necessarily used as a philosophy. It has the 3 components to it. You have your, the previous lecturer talked about a little bit about this. You have your physical posturing, you have your breathing techniques, and you have your meditation. Not all yogas have all of these. Okay, just know that, and I'll talk about that in a second. So, bottom line with yoga, when you're looking into that as an exercise regime, it does improve quality of life, it does reduce fatigue, it does enhance sleep when compared to no exercise at all. So it is very good to do. The best results, though, was obtained with physical activity, postures, movements, combined with the breathing technique. And you guys all get to sample the breathing right now, okay? So you can see how that automatically feels much better, okay? Yoga versus exercise, which one's better? Well, they're both about the same. So if you don't like to do yoga, you exercise. If you don't like exercise, you can do yoga. Remember, you can do your housework and your gardening too. I get a special thrill out of cleaning my house, so I might be weird about that, I don't know, but I feel good about it. I'm exhausted by the end, so. None of these studies followed up for very long term, maybe 3 to 6 months, but you can kind of think ahead, well, if it worked for that long, it's going to continue to work. Okay, now, longevity study, I talked about this. There was a study done, 103 people were followed from 1991 to 2016, or until they passed. They were all stage 4s, okay? They combined psychotherapy and exercise, or just psychotherapy, or just exercise. And it was specifically aimed at what would improve survivorship. In the study, what I found interesting is that those that were married or older were actually living longer. That could just be the kind of cancer that they had. Maybe it was less aggressive. Those with a reduced lifespan had more depression, and the cortisone rhythms were off. That's your stress rhythms. So stress is something to be definitely dealt with. Okay. Bottom line, what does that mean for you? Well, again, in this study, women that exercised an hour or more of moderate intensity activity improved survivorship 23%. And remember, when this movement was happening, their quality of life actually improved. Those that exercised less than 30 minutes a day of moderate intensity, 27.1 months, they lived longer than those that did not. An hour or more, they almost doubled it. And remember, the movements made quality of life better. Okay, now I want to jump back to cancer-related fatigue. During your cancer treatment, during times that you're very debilitated, you get sick, something happens to you, you have another surgery, that is when the relaxation and meditation is helpful. That part of yoga is good. You want to do that. That's going to help combat that fatigue. After cancer treatments, you can start moving. That's exactly what you want to do. You want to move. Your bodies were designed and made to move, not be sedentary. You want to use them. Physical activity reduced fatigue, whether it was aerobic, exercise, aerobic resistance, combined aerobic resistance, and or yoga. Remember, yoga and exercise were very similar in how they improved quality of life and reduced cancer-related fatigue. But remember also that yoga was also good for just when you were immobile. Okay, stress response. Yoga and physical activity reduces the stress hormone. Both of them do, okay? Remember, you want to control that. That's something that's an irritant to the body. It's going to want to eat at it, okay? At the same time, the exercise will increase the neurotransmitters, the dopamines and the GABAs. And how is that important for you? Well, it's going to reduce your psychological distress, and it's going to improve your sleep. When that happens, you improve your immunity and your healing processes. So, putting it in a bigger picture for you, if you have less stress, you're moving, you have less stress, you're feeling a little bit better, you're sleeping a little bit better, your mind and body are healing, your immune system's getting better, all the wheels start turning in a very nice, smooth fashion, and you get actually healthier. So, bottom line, how do you get started? Well, you probably want to speak to your doctor or oncologist if you have not been active for long, or you already know that you have maybe some blood work issues like anemia or cardiovascular problems because you've had radiation to your lungs, your chest area, or maybe some detrimental effects from the chemo. So you can seek out a cancer rehab specialist to help walk the journey through with you, to get you started on that journey of what exercises to do specifically for you, especially thinking that by the time you've lived this long, you've got some other things going on with you, more than likely. Cancer-related, things like osteopenia, maybe some diabetes, maybe old fractures, maybe other injuries. Those all need to be taken into account when you start moving, okay? Begin slowly. People that are in chemo, I usually don't exert them more than maybe 30% of their expenditure for the first 3 months. Same thing when you're ill. You start slow. You don't wait maybe 3 months before you start boosting it up, but you start slow to let your body kind of ramp up. It's kind of like starting a merry-go-round. You want it, that first push is a little hard, and then it gets easier. After that time, then you boost it up to about 60% spent that you're working at. Don't exercise into joint pains. It's not a no pain, no gain. It's very important that you listen to pain and you discuss it with whatever healthcare provider you're with at that time to make sure that there's nothing further happening with you. Any activity is better than none, okay? And meditation is an activity. So when you can't move about, just meditate, just breathe. That's better than nothing, okay? Most studies have shown that moderate intensity shows no significant risk of injury. So, real quick, what is moderate? You can easily converse 3 to 4 words per breath. You feel yourself breathing increase, light sweat. You can still sing, okay? Could everyone sing in YMCA? Okay. Some sense of exertion, 40 to 60% spent. So, move and choose to do so. Remember, anything is better than nothing. Start slow, talk to your doctor, get a cancer rehab specialist to work with you, or a yoga rehab specialist. Do something that gives you joy and pleasure. You want to have fun while you're doing this, okay? And it does improve quality of life for survivorship. And you guys do have that choice and power.
Thank you so much. I mean, that's really amazing, that 23% improvement with exercise. I mean, they tell us all the time how important exercise is, but it's really amazing to see it, how important it really is. So we're going to start to get our next panelists come up here while we ask a couple of questions. We have time for a couple of questions. And same drill as last time. If you have a question, just raise your hand, and they'll come over to you with the microphone and just tell.
I have a question to start out with around scanxiety. When we are ready to have a scan or know we're going to get a scan and we don't know whether we have progression, there's a lot of anxiety that happens to the point where it's hard to concentrate, hard to do anything. What kind of things could we do to overcome that anxiety of getting a scan and waiting for the results?
Testing. Ooh. Who would you like to address it? I mean, from my perspective, I generally offer a medication, a mild, quick-acting, sedating medicine if someone anticipates feeling really claustrophobic. So that's kind of a simple intervention.
Any other comments? It's a very important question.
Yeah. I would say we recently had a patient experience a lot of anxiety exactly in the situation that you're talking about. And she had come to one of our breast cancer survivorship talks that we do at Hoag, and I'd just given a talk on meditation and mindfulness. And she wasn't a regular practitioner, but had remembered that. So in the moment, she was able to draw her attention, like I was talking about, to her breath, to just kind of stay present and work through that anxiety. Because like we've said, just that forced exhalation is scientifically proven to activate the parasympathetic nervous system response in the body, which is what we need in those times of stress. Because when we say that we're feeling stress, the body is having a physical reaction. So your heart rate is increasing, your blood pressure's rising, they could be sweating, trembling, shaking, whatever it might be. So the best way for us, I mean, think about it. When somebody's having a panic attack, what are they told to do? Breathe. So that's what we have to remember. Now, obviously, in times of stress, if we're not doing any form of meditation or mindfulness, we might not immediately be thinking that we are actually able to control that stress response. So the more that we do these practices, the easier they come to mind in those feelings, in those times of additional stress and anxiety.
Thank you. We have another question over here.
I had a question for the nutritionist. There's a lot of talk about the intermittent fasting, whether doing several days a week or only eating 8 hours per day. What is your thought about that as it relates to cancer?
As it relates to cancer, I don't think I've come across any studies that show necessarily benefits from intermittent fasting as it relates specifically to cancer. There are studies on it, and typically what I will say about that is it shouldn't be an extreme thing. I think that there are definitely benefits from having a time where you stop eating and start eating again, like naturally when we are done with dinner, and then eat again at breakfast or have a later breakfast, depending on what works for your lifestyle. There have been studies that show benefit to that, or people who abstain from food for 24 hours once every couple of weeks. There have been some improved cardiovascular benefits with that. But in terms of cancer, I would say if you're not experiencing some of those symptoms that I had discussed, then it's probably safe to practice in moderation.
Great question. I really have often wondered the same thing. We have one last quick question. Yes, Dr. Salah.
So right before I left Pittsburgh, I was approached by a woman who is dealing with metastatic breast cancer and was taking high-dose intravenous vitamin C, right? Oh. And she approached me and asked me if I thought that that was good for the immune system, and I've seen nothing about it. So you had mentioned supplements, and I know they're not FDA regulated. I know there's a whole window, but I don't know if there was anything vitamin C or that you prescribe to that you think has value, or if this is kind of stay away, it's snake oil.
Yeah, I think and specifically with vitamin C is water soluble. So if we get too much of it, we urinate it out. So mega dosing it isn't as harmful as some of the other ones like A, D, and E, and K. but there's not a huge benefit, like you had mentioned, to doing so. The biggest benefit, I would say, and I'm going to say it again, is when you have those components along with the other phytochemicals in foods, the protective benefit is so much greater than just the one single component like vitamin C or beta carotene or something like that. When they are in the whole food form and we're digesting them and absorbing them, we see a lot more protective immuno benefit than the individual items on their own.
So eat oranges and eat carrots.
Yes.
Rather than giant pills. Great. Well, thank you all so much. This is a great session.